In this video, we'll be talking about Ocaliva, a medication used to treat a liver disease called primary biliary cholangitis, also known as PBC. This disease can cause damage to the bile ducts in the liver, leading to harmful substances building up and scarring the liver. Ocaliva works by reducing the production of bile and helping it flow out of the liver. This medication can help slow down the progression of PBC and reduce symptoms such as tiredness, itchy skin, abdominal pain, and dry eyes and mouth. The typical daily dosage of Ocaliva is determined by your doctor based on your specific condition. It is usually taken once a day, with or without food. It's important to take Ocaliva at the same time each day to maintain a consistent level of the medication in your body. It's best to follow your doctor's instructions on the timing of your dose to ensure the best results from the medication. Before you start taking Ocaliva, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once a day. The dosage is based on your medical condition, lab tests, and response to treatment. If you have side effects, your doctor may direct you to temporarily stop taking this medication, or to take it less often. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. If you also take certain other drugs to lower your cholesterol, take Ocaliva at least 4 hours before or at least 4 hours after taking these medications. These products can keep you from absorbing Ocaliva fully. Tell your doctor if your condition does not get better or if it gets worse. If you experience tiredness, mouth/throat pain, or fast/pounding heartbeat, it's important to let your doctor or pharmacist know. It's also important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While Ocaliva is used to treat primary biliary cholangitis, PBC, it may also cause some liver symptoms to worsen. If you experience new or worsening skin itching, nausea/vomiting, loss of appetite, abdominal pain, yellowing of the eyes/skin, dark urine, muscle/joint pain, or swelling in the legs/feet/abdomen, it's important to seek medical help right away. Your doctor may prescribe other medications or adjust your dose to help manage these side effects. It's important to discuss the risks and benefits of taking this medication with your doctor. A serious allergic reaction to Ocaliva is rare, but if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's also important to contact your doctor or pharmacist if you notice any other effects not listed here. And remember, you can always call your doctor for medical advice about side effects. Ocaliva is a medication used to treat a certain liver disease. However, it's important to note that it can cause serious, even fatal, worsening of liver function, especially when taken at a higher dose than recommended. Your doctor will prescribe your dose based on your medical condition and how you respond to treatment. It's crucial to follow your doctor's dosage instructions carefully to minimize the risk of side effects. Before starting treatment with Ocaliva, your doctor will order lab tests to determine if you have severe liver disease. It's important to note that this medication should not be used by people with certain types of liver disease, so consult your doctor for more details. During treatment, your doctor will also order lab tests and monitor for symptoms of worsening liver function. As for the best time to take Ocaliva and the optimal daily dosage, your doctor will provide you with specific instructions based on your individual needs. Before taking Ocaliva, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have a history of bile duct blockage. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, Ocaliva should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Always follow your doctor's recommendations for the best time to take Ocaliva and the appropriate dosage for your specific condition. When taking Ocaliva, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Ocaliva is fezolinetant. Always consult with your healthcare provider before taking any new medications while on Ocaliva. If someone has taken too much Ocaliva and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. In Canada, residents can reach out to their provincial poison control center for assistance. It is important not to share Ocaliva with others. Before starting this medication and while taking it, it is crucial to have lab and/or medical tests done, such as cholesterol levels and liver function tests. Make sure to keep all medical and lab appointments. If you forget to take a dose of Ocaliva, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. It is important to store Ocaliva at room temperature and away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When disposing of Ocaliva, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It is recommended to consult your pharmacist or local waste disposal company for guidance on the proper disposal of Ocaliva. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.